Hello and welcome. In this video, you'll find a basic guide on how to use Psychopoints in a simple and safe way. We'll go through the 3 most important things to help you start well: how much pressure to use, how long to hold a point, and which signals to notice in your body. This is an introductory guide designed to give you a clear foundation before moving on to the exercises in the book. The first important thing is this: you do not need to press hard. I'll repeat it because it really is the key point. With Psychopoints, you do not need to press hard. In most cases, gentle, clear, gradual pressure works better. The goal is not to force the body, but to listen to it. If you want to remember just one sentence, keep this one: clear pressure, but manageable. When you find a body area in the book, for example, the neck, shoulders, jaw, or chest, you do not need to find the perfect point down to the millimeter. You simply start from the area indicated. Explore slowly with your fingers and look for a point that feels a little more sensitive than the others. It should be a point you can feel clearly, but that still stays tolerable. So you do not need perfect precision. You need to stay in the right area and listen to your body. For pressure, you can use a very simple scale from 0 to 10. 0 or 1 is just a light touch. 2 or 3 is gentle pressure, and that is the best place to start. 4 or 5 is medium pressure, but only if the point is well tolerated. In general, you do not need to go beyond that for this kind of practice. The practical rule is simple. You should feel the point clearly, but still stay comfortable. If you notice that your body tightens, your breathing gets stuck, your jaw starts clenching, or you feel sharp pain, you are pressing too much. In that case, lighten the pressure. That is completely normal, and it is perfectly fine. Now let's talk about timing. To begin, hold the point for about 10 to 20 seconds, then release slowly. If the point feels well tolerated, you can stay a little longer, up to about 20 to 40 seconds. Usually, 1 or 2 rounds per point are enough. Then you move to the other side or to the next point. You do not need long or intense sessions. With Psychopoints, consistency often works better. Just a few minutes, done well. While you hold the point, you do not need any complicated breathing technique. Breathe naturally, and if you want, simply make the exhale a little slower. Inhale normally and exhale gently. If you notice that your breathing becomes tight or shallow while you press, that is a useful signal. It usually means you are forcing too much. In that case, soften the pressure. As you work with Psychopoints, you may notice different sensations, and that is normal. For example, local sensitivity, mild discomfort, warmth, a sense of release in the area, a deeper breath, a yawn, a swallow, or even a small emotion coming up. These are fairly common responses. Every body reacts differently, so you do not need to look for a special sensation. You just need to work calmly and gradually. There are, however, some signals that mean it is better to stop or significantly lighten the pressure. For example, sharp pain, dizziness, nausea, strong tingling, increasing agitation, or discomfort that gets worse instead of settling. In these cases, release the point, take a few breaths, and if you want to try again, use a much lighter touch. If an area feels too sensitive that day, you can also skip it. That is completely okay. Now let's do a very simple practical example. Let's use the shoulder. Place your fingers on the area without pressing hard. Explore slowly and look for a point that feels a little more sensitive. When you find it, apply gentle pressure and pause there. Remember, clear pressure, but manageable. Stay on the point for about 15 to 20 seconds, breathing naturally and letting the exhale become a little slower. If you feel the area tightening, lighten the pressure. If it feels tolerable, continue. Then release slowly. You can repeat once more or move to the other side. This is the basic method, and you can use it in many areas of the body. Find the area, locate the point, use gentle pressure, breathe, hold for 10 to 20 seconds, and release slowly. Perfect. Now you have a clear foundation to start using Psychopoints in a simple and safe way. Remember the key phrase: clear pressure, but manageable. A little done well is better than too much. With this foundation, you can move on to the videos for each body area with more confidence. See you soon. Hello and welcome. In this video, we'll do a quick Psychopoints routine for the head and face area, helpful when you feel mental tension, stress, a heavy forehead, a tight jaw, or that too much in my head feeling. It's a simple, short practice, and you can repeat it anytime you feel the need to release some tension. Before we begin, one important rule. On the face, always use light pressure. There's no need to press hard. The key phrase still applies here. Clear pressure, but manageable. If a point feels too sensitive, lighten the pressure right away.
Let's start with a small grounding moment. Rub your hands together for a second, just enough to warm them slightly. Then place your palms softly on your face, over your cheeks or cheekbones. Don't press, just let your hands rest there. Take a slow breath, and another one. Let your face settle into your hands and allow your jaw to soften. Now let's move to the jaw. Bring your fingers to the sides of the face, to the jaw muscle area between the cheekbone and the angle of the jaw. Look for a point that feels a little more sensitive without digging in. When you find it, apply gentle pressure and stay there for about 10 to 20 seconds. Breathe naturally and let the exhale become a little slower. If you want, let your mouth stay slightly soft without clenching your teeth. Now move to the temples. Place your fingertips on the temples, one on each side, and use very light pressure. A little goes a long way here. There's no need to rub hard. You can simply keep a steady, soft contact. Stay there for about 10 to 15 seconds, breathing slowly. If you prefer, you can make a very small, slow circular motion, but keep the pressure minimal. Next, move to the eyebrow area. We'll work along the brow bone, not on the eye. Place your fingers at the beginning of the eyebrow, near the inner side, and find a point that feels delicate but noticeable. Hold gentle pressure for about 8 to 10 seconds. Then move toward the center of the eyebrow and do the same. Light pressure, slow breath, just a few seconds. Now switch to the other side, beginning of the eyebrow. Then the center of the eyebrow. Keep the contact light and the breathing calm. This area is very helpful when your forehead feels full, your eyes feel tired, or your mind feels overloaded. Now bring 1 or 2 fingers to the center of the forehead. Place a soft contact there. Without pushing, stay here for about 10 to 20 seconds. Breathe and let the forehead soften. If you like, you can imagine creating a little more space in the forehead as you exhale. Now let's move behind the ears to the side of the base of the skull. Bring your fingers behind the ears in a soft area and find a comfortable contact. Again, no force is needed. Hold gentle pressure for about 10 to 20 seconds, breathing naturally. This area often helps release head tension and creates a broader sense of relief. Release slowly. To finish, bring your palms back to your face or forehead. Just like at the beginning, take one last slow breath and let the air out gently. Take a moment to notice how your face, jaw, eyes, and forehead feel now.
Perfect. This is a quick head and face routine you can use whenever you feel stress, mental tension, or facial tightness. You can do the whole routine or repeat only the steps that feel most helpful in that moment. Always remember, clear pressure, but manageable. And on the face, even more than anywhere else, work gently. See you soon. Hello and welcome. In this video, we'll do a quick Psychopoints routine for the neck and throat area, helpful when you feel neck stiffness, tension along the sides of the neck, a sense of tightness, or that classic lump in the throat feeling. It's a short and gentle practice designed to help you release tension without forcing anything. Before we begin, one important rule: always work gently on the neck and throat. There's no need to press hard, and most importantly, avoid direct pressure on the center of the throat. We'll stay on the sides of the neck, the base of the neck, the collarbones, and the upper chest. The key phrase applies here too: clear pressure, but manageable.
Let's start with a small grounding moment. Place one hand on the upper chest, over the top of the sternum, and the other hand on the side of the neck or on the collarbone. Don't press, just let your hands rest there. Take a slow breath, and another one. Let the jaw soften, the shoulders soften, and the throat soften. Now let's move to the side of the neck. Bring your fingers to the side of the neck, not the center, in the area that runs from below the ear down toward the collarbone. Explore slowly and look for a point that feels a little more sensitive. When you find it, apply very gentle pressure and pause there for about 10 to 15 seconds. Breathe naturally and let the exhale become a little slower. If it feels too sensitive, lighten the pressure right away. Release slowly and move slightly to another point in the same area, still on the side of the neck. Hold again for 10 to 15 seconds with the same soft contact. Then switch to the other side and repeat in the same way. Find a point that feels sensitive but tolerable. Use light pressure, keep the breath calm, and release slowly. Now move to the area where the neck meets the shoulder, at the base of the neck. Place your fingers there, near the neck-shoulder junction, and look for a tense spot. Here you can use a little more pressure than on the throat area, but it should still feel manageable. Hold the point for about 10 to 20 seconds while breathing slowly. Then switch to the other side and do the same. This area is often very helpful when the neck feels stiff or the shoulders feel high and tense. Now let's move to the collarbones. Place your fingertips above the collarbones or just below them in a soft area. There's no need to dig in or press hard. Just keep a light, steady contact for about 10 to 15 seconds. If you want, you can do one side first and then the other, or stay on both sides at the same time, whichever feels more comfortable. Keep breathing calmly. Now bring one hand or two fingers to the upper part of the sternum, below the throat, but not on the trachea. The contact here should be soft. We are not pressing on the throat. We are simply creating a gentle point of support at the top of the chest. Stay here for about 10 to 20 seconds and let the exhale become a little longer. Many people find that this area helps release that feeling of tightness or closure. To finish, leave one hand on the upper chest or on the collarbone. Take a calm breath and exhale slowly. If it feels natural, you can swallow gently without forcing it. This small step often helps release residual tension in the throat.
Perfect. This is a quick routine to release shoulder tension and lighten that feeling of carrying weight. You can use it on its own or together with the neck and throat video if the tension feels spread across the whole area. Always remember, clear pressure, but manageable. A little, done well, is better than too much. See you soon. Hello, and welcome. In this video, we'll do a quick Psychopoints routine for the shoulder area, helpful when you feel tension, stiffness, raised shoulders, or that feeling of carrying too much weight on you. It's a short, simple practice, and you can use it anytime during the day, especially when stress starts building up right there. Before we begin, one important rule. Even on the shoulders, you do not need to press hard. Here we can use a little more pressure than on the face or throat, but it should still feel manageable. Keep the key phrase in mind. Clear pressure, but manageable. If your neck tightens or you start holding your breath, lighten the pressure.
Let's start with a small grounding moment. Place one hand on one shoulder and the other hand on the other shoulder, or one hand on your shoulder and one on your chest, whatever feels more comfortable. Take a natural breath and then exhale slowly. As you exhale, let your shoulders drop. One more time. Inhale and exhale gently, as if you were letting go of a little weight. Now let's go to the most common point, the upper trapezius, where the neck meets the shoulder. Bring your fingers to that area and look for a spot that feels a little more sensitive. When you find it, apply gentle but clear pressure. Don't dig in. Look for a steady, comfortable contact, something you can feel clearly, but that stays tolerable. Hold the point for about 10 to 20 seconds and breathe slowly. Release slowly and look for a second point in the same area, a little more forward or a little farther back. Hold again for about 10 to 15 seconds with the same kind of pressure. Then move to the other shoulder and do the same. Find the point, apply manageable pressure, breathe, and let tension drop as you exhale. If you feel the neck tightening, ease off a little. Now let's move to the upper outer part of the shoulder, a little farther out. Bring your fingers to the muscular part of the shoulder and look for a sensitive spot, but not too close to the bony area. When you find it, use clear but soft pressure and hold for about 10 to 15 seconds. Breathe naturally. Then switch to the other side and repeat in the same way. Now, let's move to the back of the shoulder. Reach one hand behind to the opposite shoulder and look for an area that feels tense or sensitive. Here you can use your fingertips or a soft pinch grip, always without forcing. Hold the point for about 10 to 15 seconds with slow breathing. Then switch sides and do the same. This area is often very helpful when the shoulders feel closed or pulled forward. Now we'll add a very useful step. Pressure plus a small movement. Go back to one point on the top of the shoulder, either on the trapezius or the upper shoulder area, and hold gentle pressure. While you keep the contact, make a small shoulder movement, a tiny circle, or a slow lift and drop. Just a few seconds is enough. Then stop, stay on the point, and take a slow exhale. Repeat once on the other side. To finish, place your hands on your shoulders again, like at the beginning, or use a soft self-contact, like a half hug. Take a calm breath and exhale slowly. Let the shoulders drop without forcing. Take a moment to notice how your neck, shoulders, and upper chest feel.
Perfect. This is a quick routine to release shoulder tension and lighten that feeling of carrying weight. You can use it on its own or together with the neck and throat video if the tension feels spread across the whole area. Always remember, clear pressure, but manageable. A little, done well, is better than too much. See you soon. Hi, welcome. In this video, we'll do a short Psychopoints routine for the chest and heart area, helpful when you feel anxiety, tightness in the chest, tension in the upper chest, or shortness of breath. This is a brief and gentle practice designed to create a little more calm and a little more space in your breathing without forcing anything. Before we begin, one simple and important note. If you have strong or sudden chest pain or any unusual symptoms, this video is not the right tool and you should get medical evaluation. Here, we're only working with non-urgent tension, anxiety, and chest tightness as a self-help practice. For this area, always work gently. There's no need to press hard. On the chest, contact should feel calming, not invasive. The key phrase still applies, clear pressure, but manageable.
Let's begin with a moment of centering. Keep one hand on the chest and one on the upper belly, whatever feels more comfortable. Don't press, just allow the contact. Take a natural breath and then exhale slowly. Again, inhale without forcing, and exhale a little more softly. We're not trying to change the breath, we're simply accompanying it. Now bring 2 fingers or the soft palm of your hand to the sternum in the upper chest area. Keep a steady but light contact for about 10 to 20 seconds. Breathe naturally and let the exhale lengthen a little. Then move slightly lower, still in the center of the chest, and do the same. light, steady contact for 10 to 20 seconds. If the area feels too sensitive, reduce pressure right away. Now move to the area just below the collarbones. Place your fingers just under one collarbone in a soft area of the upper chest. Don't dig in. Simply look for a point that feels a little more tender. Apply gentle pressure and stay there for about 10 to 15 seconds, breathing calmly. Then move to a second point under the same collarbone and repeat. After that, switch to the other side and do the same sequence. This area is often very helpful when the breath feels high or the chest feels closed. Next, move a little more to the side, in the upper outer chest, closer to the shoulder, but still in the soft tissue of the chest. Find a sensitive but tolerable point and hold clear, gentle pressure for about 10 to 15 seconds. Breathe and let a little tension go as you exhale. Then repeat on the other side in the same way. Now, we'll do a simple regulation step. Place one hand in the center of the chest and the other on the upper chest or upper ribs. Take 2 or 3 easy breaths. Inhale normally and exhale a little more slowly. Don't force depth, just look for a softer rhythm. If you want, as you exhale, you can think, I create a little more space. To close, bring both hands back to the chest as at the beginning. Take one calm breath and exhale slowly. And one more. Notice the contact of your hands, the movement of the chest, and the SPAC you feel now. Even a small change is enough. We're not trying to force a big release, only a little more calm and a little more space.
Perfect. This is a quick routine for the chest and heart area, useful when you feel anxiety, tightness, or short breath. You can use it on its own, or together with the neck, throat, and shoulders videos if you feel tension across the whole upper body. And always remember, clear pressure, but manageable. And on the chest, even more than anywhere else, work gently. Don't force the breath, accompany it. See you soon. Hi, and welcome. In this video, we'll do a quick Psychopoints routine for the solar plexus and stomach area, helpful when you feel anxiety in the belly, a knot in the stomach, tension in the upper abdomen, or that tight feeling that makes it hard to breathe freely. This is a short and gentle practice, designed to help you create a little more space and calm without forcing anything. Before we begin, one simple and important note. If you have strong, sudden, or persistent pain, or any significant symptoms, this video is not the right tool, and you should seek medical evaluation. Here, we're only working with tension and stress-related tightness as a self-help practice. For this area, always work gently. There's no need to press hard. In the solar plexus and stomach area, we're looking for release, not pressure. The key phrase still applies here too. Clear pressure, but manageable.
Let's begin with a moment of centering. Place one hand on the lower chest near the sternum and the other hand on the upper belly in the stomach area. Don't press, just allow the contact. Take a natural breath and then exhale slowly. Once again, inhale without forcing and exhale a little more softly. Let the belly move however it can without trying to control it. Now bring one hand or 2 or 3 fingers to the solar plexus area, which is the upper abdomen just below the sternum. There's no need to dig in and no need to push. Rest with a steady but light contact and stay there for about 10 to 20 seconds. Breathe naturally and let the exhale become a little slower. If the area feels too sensitive, lighten the pressure right away. Release slowly and move slightly within the upper stomach area, staying in the soft part of the abdomen. Look for a point that feels a little more sensitive, but still tolerable. When you find it, apply gentle pressure and hold for about 10 to 15 seconds. Breathe calmly. Then you can move to another nearby point, still in the upper belly, and repeat in the same way. If you want, you can work a little more toward the center and then slightly toward the left side. always with a gentle contact. Now bring your attention to the area under the ribs on the sides very gently. Place your fingers under the rib margin without going deep. Here, think more of a listening contact than a real pressure. Keep the contact for about 10 to 15 seconds on one side, then switch to the other side. Breathe slowly. This area often helps when the diaphragm feels tight or the breath feels stuck high up. Now let's return to the center for a regulation step. Place one hand on the solar plexus and the other hand on the upper belly. Take 2 or 3 calm breaths, inhale normally, and exhale a little more slowly. Don't force the breath and don't try to make the belly perfectly soft. Just look for a calmer rhythm. If you want, as you exhale, you can think, I create a little more space. To close, place both hands one over the other on the upper belly, over the solar plexus and stomach area. Take one last calm breath and exhale slowly, and one more. Notice for a moment how the area feels now. Even a small change is enough. We're not trying to force a big release, only a little more calm and a little more space.
Perfect. This is a quick routine for the solar plexus and stomach area, helpful when you feel anxiety, tightness, or tension in the upper belly. You can use it on its own or together with the chest and heart video if you feel constriction through the whole center of the body. Always remember, clear pressure, but manageable. In this area, even more, work gently. Don't force the breath. Accompany it. See you soon. Hi and welcome. In this video, we'll do a quick Psychopoints routine for the belly and intestine area, helpful when you feel abdominal tension, digestive stress, a tight belly, or that restless feeling in the abdominal area. This is a short and gentle practice designed to help calm the body and create a little more space in the belly without forcing anything. Before we begin, one simple and important note. If you have strong, sharp, or persistent pain, fever, or unusual symptoms, this video is not the right tool, and you should seek medical evaluation. Here, we're only working with abdominal tension and stress as a self-help practice. For the belly area, always work gently. We do not need strong pressure. Here, the goal is not to push, but to listen. The key phrase still applies in this area too. Clear pressure, but manageable.
Let's begin with a moment of centering. Place your hands on your belly, one on top of the other, around the navel or slightly below, wherever feels more comfortable for you. Don't press, just allow the contact. Take a natural breath, and then exhale slowly. Once again, let the abdomen move however it can, without forcing it. Now we'll do a very simple pass through 3 zones. Move your hands a little higher, to the upper belly above the navel. Keep a steady but soft contact for about 10 to 15 seconds, and breathe calmly, then move to the middle area, around the navel, and stay there for another 10 to 15 seconds. Finally, move a little lower, below the navel, and keep the same gentle contact for another 10 to 15 seconds. This step helps the body map and soften the abdomen without being intrusive. Now let's move to the sides of the belly. Place your fingers on the side of the abdomen, beside the navel, in a soft area. Look for a point that feels a little more sensitive, but still tolerable. When you find it, apply gentle pressure and stay there for about 10 to 15 seconds. Breathe slowly. Then, if you want, move to a second nearby point and repeat. After that, switch to the other side and do the same. Remember, there's no need to press hard. We're looking for clear, gentle contact. Now we'll work around the navel, but without pressing directly on the navel. If the area feels sensitive, choose 2 or 3 points around it. For example, one above, one to the side, and one below. At each point, place your fingers and keep a light contact for about 8 to 12 seconds. Breathe naturally. This area can be very helpful when the belly feels tense or closed from stress. Now let's do a regulation step with the breath. Place one hand on the upper belly and one hand on the lower belly. Take 2 or 3 calm breaths. Inhale normally and exhale a little more slowly. Don't force the belly to expand. Let it move however it can. The idea is to accompany the breath, not control it. To close, bring your hands back, one over the other on the belly like at the beginning. Take one last calm breath and exhale, die. And one more, notice for a moment how your abdomen too, or calm and more listening.
Notice for a moment how your abdomen feels now. Even a small change is enough. We're not trying to force a big release. We're simply looking for more calm and more listening. Perfect. This is a quick routine for the belly and intestines that you can use when you feel digestive stress, abdominal tension, or a tight belly. You can use it on its own or together with the solar plexus and chest videos if you feel the tension higher up. Always remember, clear pressure, but manageable. And on the belly, even more than anywhere else, work gently. See you soon. Hi and welcome. In this video, we'll do a quick Psychopoints routine for the upper and lower back, helpful when you feel tension, stiffness, or that overloaded feeling that builds up in the back, between the shoulders, through the mid-back, and into the lower back. This is a simple and realistic practice, designed to work on the parts of the back you can reach on your own without forcing anything. Before we begin, one simple and important note. If you have sharp pain, a recent injury, strong pain that travels down the leg, significant tingling, or intense symptoms, this video is not the right tool, and you should seek professional evaluation. Here, we're only working with non-urgent tension and overload as a self-help practice. The same basic rule applies for the back. Clear pressure, but manageable. And one more important thing, we do not need to reach everything. We work well on the areas we can access, and we help the back let go with breath and small movements.
Let's begin with a moment of centering. Place one hand on your chest. If you can, bring the other hand behind you to an area of the back or side body that you can reach comfortably. If that doesn't feel easy, it's completely fine to keep both hands in front. Take a natural breath and exhale slowly. One more time. As you exhale, try to feel the breath widening into the back as much as you can. Now let's work on the upper back in the area behind the shoulder. Bring one hand to the back of the opposite shoulder and look for a point that feels a little more sensitive between the back of the trapezius and the edge of the shoulder blade. When you find it, apply gentle but clear pressure and stay there for about 10 to 15 seconds. Breathe calmly. Then move to a second nearby point and repeat. After that, switch to the other side and do the same. Now try moving slightly lower into the area behind the shoulder blade wherever you can reach with the crossed hand. There's no need to find the perfect point. Just look for an area that feels a little tighter and keep a manageable contact for 10 to 15 seconds. Then switch sides. Remember, we do not need to reach the whole back. Even working well on these accessible areas can help the rest of the back relax. Now let's move to the lower back, but we'll work on the sides, not directly on the spine. Bring one hand to the side of the lower back, above the pelvis, and away from the spine on the back side of the body. Look for a slightly sensitive point and place a steady contact there with gentle or medium pressure, always manageable. Hold for about 10 to 20 seconds while breathing slowly. Then switch to the other side and repeat. Now bring one hand to the center of the low back, over the sacrum, just above the tailbone. There's no need to press hard here. Just place the palm and keep a steady, reassuring contact for about 15 to 20 seconds. Breathe calmly and let the exhale become a little slower. Many people feel an immediate sense of stability with this step. Now let's add a small movement to help the back release without forcing. Place your hands on the lower back or the hips and make a very small pelvic sway. You can imagine a tiny forward and back movement or a small gentle rocking. A few seconds are enough. Then stop and take a slow exhale. This step helps loosen tension that feels stuck. To close, place one hand on the chest and one hand on the lower back, on the lumbar area or sacrum, wherever feels more comfortable. Take 2 calm breaths. Inhale normally and exhale slowly. One more time. Notice the contact in front and in back. We do not need to release everything at once. We're simply looking for a little more space and a little less weight.
Perfect. This is a quick routine for the upper and lower back that you can use when you feel tension, stiffness, or overload. You can do it on its own or combine it with the neck, shoulders, and chest videos if you feel tension through the whole upper body. Always remember, clear pressure, but manageable. And for the back, avoid direct pressure on the spine. Work on the sides slowly and gently. See you soon. Hi, and welcome. In this video, we'll do a quick Psychopoints routine for the pelvis and hips, helpful when you feel tension in the lower body, stiffness in the hips, a sense of holding, or a need for grounding and stability. This is a simple, gentle, and very practical practice designed to help you create more space and a stronger sense of grounding without forcing anything. Before we begin, one important note: if you have sharp pain, a recent injury, strong inflammation, or recent surgery in this area, stop and get it evaluated. Here, we're only working with stress-related tension and stiffness as a self-help practice. And one more essential point, in this video, we stay only in the outer, accessible areas of the pelvis and hips. There is no need to force anything. The same basic rule applies here too. Clear pressure, but manageable. And in this area, even more than usual, we work with respect and gradualness. We're looking for stability and space, not intensity.
Let's begin with a moment of centering. Place your hands on the sides of the pelvis, on the hips, or one hand on the lower belly, and one on the side body, whatever feels more comfortable. Don't press, just allow the contact. Take a natural breath and exhale slowly, one more time. If you want, also notice the contact of your feet with the floor or the weight of your body on the chair or support you're using. Now let's move to the front of the pelvis near the iliac crest. Bring your fingers to the front sides of the pelvis near the front bony point. Don't work directly on the bone. Look for the soft area next to it. Explore slowly and find a point that feels a little more sensitive. When you find it, apply gentle but clear pressure and stay there for about 10 to 15 seconds. Breathe calmly, then move to a second nearby point and repeat. After that, switch to the other side and do the same. Now let's move to the outer hip, in the area between the side body and the upper glute. This area often holds a lot of tension, even when we don't realize it. Bring your hand to the outer side of the hip and look for a sensitive but tolerable point. You can use the palm or your fingertips. Hold clear, manageable pressure for about 10 to 20 seconds. Breathe slowly. If you want, you can look for a second point slightly more forward or slightly more back and repeat. Then switch to the other side and do the same. Now we'll work at the front hip crease, but only in the outer lateral part. We stay in an outer and safe area without moving inward. Use a light contact here. Find a delicate point, place your fingers there, and stay for about 8 to 12 seconds. Breathe calmly. Then switch to the other side and repeat the same way. In this area, less force and more listening. Now bring one hand behind you to the sacrum area. At the center of the low back above the tailbone, place the palm with a steady but soft contact. There's no need to press. Stay here for about 15 to 20 seconds and let the exhale become a little slower. This point often helps create an immediate sense of stability and support. Now let's add a small movement to integrate the work. Bring your hands to the sides of the pelvis, on the hips, and make a micro-pelvic sway. The movement is very small and slow. You can gently rock a little from right to left, or make a tiny forward and back movement. A few seconds are enough. Then stop and take a slow exhale. To close, leave your hands on the hips, or keep one hand on the lower belly and one on the side body. Take 2 calm breaths. Inhale normally and exhale slowly. One more time. If you want, feel the weight of the body dropping a little downward. We do not need to release everything at once. We're simply looking for more stability, more space, and a little more grounding.
Perfect. This is a quick routine for the pelvis and hips that you can use when you feel tension, stiffness, or the need for grounding. You can do it on its own, or together with the lower back and legs videos if you want to work with the whole lower body. Always remember, clear pressure, but manageable. In the pelvis area, we work with respect and gradualness. See you soon. Hi and welcome. In this video, we'll do a quick Psychopoints routine for the legs, knees, and feet. Helpful when you feel tension in the lower body, stiffness in the legs, low stability, or that feeling of being too much in your head. This is a simple and very practical practice designed to help you reconnect with presence, grounding, and contact with the body. Before we begin, one important note. If you have sharp pain, significant swelling, a recent injury, or strong inflammation, stop and get it evaluated. And for the knees, remember one simple rule. We work around the joint. We do not press hard directly on the kneecap. The key phrase applies here too. Clear pressure, but manageable.
Let's begin with a moment of centering. Place your hands on your thighs, or one hand on a thigh and one near the knee, whatever feels more comfortable. Don't press. Just allow the contact. Take a natural breath and exhale slowly. One more time. Try to feel the weight of the legs and the contact of the feet with the floor. Now let's work on the front of the thighs. Bring your hands to the central muscle area of the thigh, avoiding the groin and the bone. Look for a point that feels a little more sensitive and hold gentle or medium pressure, always manageable, for about 10 to 15 seconds. Breathe slowly. If you want, you can move to a second nearby point and repeat. Then switch to the other thigh and do the same. This step is very helpful for bringing attention down into the body and releasing general tension. Now let's move to the outer side of the thigh. Place your palm or fingers on the side of the thigh and look for an area that feels a little sensitive, but tolerable. Apply clear but gentle pressure and stay there for about 10 to 15 seconds. Breathe calmly, then switch to the other side and repeat. If this area feels very sensitive, use less pressure. That's absolutely fine. Now let's work around the knee. Here we stay gentle, avoid the kneecap in the center. Place your fingers above the knee in a soft area and keep a light contact for about 8 to 12 seconds. Then move to one side of the knee, again in a soft area, and do the same. If you want, you can also add another point on the other side of the knee, always with light, controlled pressure. Then switch to the other leg and repeat. Remember, around the joint, not directly on it with force. Now let's move to the calves. Place one hand on the soft part of the calf, avoiding the area directly behind the knee. You can use the palm or a soft pinch with your fingers. Look for a sensitive but tolerable point and hold for about 10 to 15 seconds. Breathe slowly. Then move to the other calf and repeat in the same way. This step is very helpful for releasing tension and helping the body drop down. Now we'll work on the ankle and foot. Place your fingers around the ankle, near the ankle bone, but without pressing on the bone itself. Look for a soft area around it and keep a light contact for a few seconds. Then bring your thumb or fingers to the center of the sole of the foot and apply gentle pressure for about 10 to 15 seconds. This point is very helpful for grounding. Breathe calmly. Then move to the other foot and repeat. Ankle gently, then center of the sole. To close, place your hands back on your thighs or one hand on the chest and one on the belly, however you prefer. Take 2 calm breaths. Inhale normally and exhale slowly. One more time. Now bring your attention to the feet. Feel the contact with the floor. Let the weight drop into the feet without forcing.
Perfect. This is a quick routine for the legs, knees, and feet that you can use when you feel tension, instability, or the need to reconnect with presence and grounding. You can do it on its own or after the pelvis and hips video to complete the work for the lower body. Always remember, clear pressure, but manageable. We come down into the body, one step at a time. See you soon. Hi, and welcome. In this video, we'll do an evening Psychopoints protocol for the jaw, helpful when you feel tension on the sides of the face, clench your teeth, tighten your jaw, or reach the end of the day with a jaw that feels stiff and tired. This is a slow and gentle practice designed to help the area release before sleep without forcing anything. Before we begin, one simple and important note. If you have strong pain, jaw locking, painful clicking, a recent injury, severe tooth pain, or an active dental issue, you need a professional evaluation. This video is a self-help practice for stress-related jaw tension and clenching. In this area, always work gently. The jaw does not need strong pressure. The key phrase applies here too. Clear pressure, but manageable. And one more important thing, during the practice, keep the mouth soft without clenching the teeth. If it helps, let the tongue stay relaxed.
Let's begin with a moment of centering. Place your palms on your cheeks, on the sides of the face, or over the jaw area, wherever you feel more contact. Don't press. Just let the hands rest. Take a slow breath and exhale gently. One more time. Let the jaw soften. If you want, let the teeth separate slightly, naturally, without opening the mouth too much. Now, let's move to the jaw muscle, the masseter, on the side of the face between the cheekbone and the angle of the jaw. Place your fingertips there and look for a point that feels a little more sensitive. When you find it, apply light or light to medium pressure and stay there for about 10 to 15 seconds. Breathe slowly. Remember, less force, more listening. Release slowly and move to a second point in the same area, a little higher or a little lower. Hold again for 10 to 15 seconds with manageable pressure. Then move to the other side and do the same sequence. First point, breathe. Slow release. Second point. Always with a soft mouth and unclenched teeth. Now place your fingertips on the temples, one on each side. Here, the contact should be very light. There's no need to massage strongly. You can simply keep a steady, soft contact for about 10 to 15 seconds, breathing calmly. If it feels more natural, you can make a very slow microcircle, but with minimal pressure. Now let's move in front of the ears, in the outer jaw joint area. Place your fingers just in front of the ear without pressing hard. Here, a very light contact is enough. Stay for about 8 to 10 seconds on one side, then switch to the other. Keep the mouth soft and the jaw relaxed. If this area feels sensitive, lighten even more. Now we'll work on the side of the cheek, below the cheekbone. Place your fingers on the soft part of the cheek and look for a delicate but noticeable point. Hold light pressure for about 8 to 12 seconds and breathe slowly. Then switch to the other side and repeat. This step helps release facial tension that often comes with clenching. Now let's move along the lower edge of the jaw on the outer side. Place your fingertips under the jawline without going toward the center of the throat and without digging in. Choose a comfortable point and keep a light contact for about 8 to 10 seconds. Then switch to the other side. Here too, work gently. Now let's do a small closing step connecting the jaw, neck, and throat. Place one hand on the collarbone or upper chest and the other hand on the side of the neck. Take a slow breath and exhale gently. One more time. If it feels natural, you can do a soft swallow without forcing. This often helps release leftover tension in the throat and jaw area. To close, bring your hands back to the cheeks or keep one hand on the jaw and one on the chest. Take 2 calm breaths. Inhale normally and exhale slowly. Let the jaw feel heavy. Let the mouth stay soft. We do not need to force a big release. We're simply lowering the tension level and letting some of it go.
Perfect. This is an evening Psychopoints protocol to release the jaw and reduce stress-related clenching. You can use it in the evening, before sleep, or anytime you feel the jaw is too active or tight. Always remember, clear pressure, but manageable. And for the jaw, even more than usual, work gently. See you soon. Hi and welcome. In this video, we'll do a nighttime Psychopoints routine, designed to help the body slow down when you're dealing with insomnia, restless sleep, an active mind, or evening tension. This is a slow and gentle practice to use before sleep without forcing anything. Before we begin, one simple note. If your insomnia is persistent, very intense, or linked to other important symptoms, it can be helpful to talk with a professional as well. This practice is meant to support you in calming evening tension and agitation. And one important thing, especially here, we are not trying to force sleep. We're simply creating the conditions for the body to slow down. The basic rule applies in this routine too. Clear pressure, but manageable. If a point feels too sensitive, lighten the pressure.
Let's begin. Place one hand on your chest and one hand on your belly. Don't press, just allow the contact. Take a natural breath and exhale slowly. One more time and one more. Don't force the breath, accompany it. Tonight, we're not here to perform. We're just here to lower the overall tone. Now, bring your fingers to the sides of the jaw in the masseter area between the cheekbone and the angle of the jaw. Look for a point that feels a little more sensitive and hold light pressure for about 10 to 15 seconds. Keep the mouth soft without clenching the teeth. Release slowly and move to a second point in the same area. Then switch to the other side and do the same. As you work, let the exhale become a little slower. Now place your fingertips on the temples, one on each side. The contact here is very light. Hold the point for a few seconds, breathing calmly. Then bring 1 or 2 fingers to the center of the forehead and stay there with a steady but soft contact. If you want, you can also add a point along the brow line with light pressure. The idea is simple. Soften the forehead and take some load off the head. Now let's move to the neck and collarbones. Place one hand on the side of the neck, not in the center of the throat, and look for a delicate but noticeable point. Hold very gentle pressure for about 10 to 15 seconds, then switch to the other side. After that, place your fingertips above the collarbones or just below them in a soft area. Keep a light contact and breathe slowly. If you feel a small knot in the throat or upper tension, this area often helps a lot. Now let's move to the chest. Place one hand or two fingers on the upper sternum in the center of the chest. Keep a light, steady contact for about 10 to 20 seconds. Then, if you want, move slightly lower and repeat. There's no need to press. On the chest, contact should calm, not invade. Breathe naturally and let the exhale lengthen a little. Now place one hand on the solar plexus below the sternum, and the other hand on the upper belly. Stay here for a few breaths. Don't push. Don't try to open the belly. Let it move however it can. If you want, you can work one small point in the upper stomach area with very gentle pressure for about 10 seconds, and then return to the hand contact. Now move both hands down to the belly, one over the other, around the navel or slightly below. Keep a steady and soft contact. Take 2 slow breaths. Inhale normally and exhale gently. To close, choose the contact that feels most calming for you. One hand on the chest and one on the belly, or the palms on the cheeks. Take another 2 or 3 calm breaths. Let the jaws stay soft. Let the forehead smooth out. Let the chest and belly rest into the breath.
We do not need to fall asleep right away. We do not need to force anything. We're simply slowing down. And often, when the body feels safer and less activated, sleep comes more easily. Perfect. This is a nighttime Psychopoints routine for insomnia and restless sleep. You can use it every evening or only on the days when you feel more activated. Even a few calm minutes can help a lot. Always remember, clear pressure, but manageable. And at night, even more than usual, less force and more listening. See you soon. Hi, and welcome. In this video, we'll do a quick self-soothing Psychopoints practice for those moments when you feel stressed, agitated, or tense in the body, and you notice your skin also feels more sensitive, reactive, or flared up. This is a short and gentle routine designed to calm the nervous system and lower the overall activation level without forcing anything. Before we begin, one simple and important note. If you have a major flare-up, an infection, wounds, intense pain, or new symptoms, you need medical evaluation. This practice does not replace medical or dermatological care. Here, we're working with stress, tension, and self-regulation. And one essential point, we avoid working directly on irritated or injured areas. You do not need to touch the problem area to help the body calm down. The basic rule applies here too. Clear pressure, but manageable. And in this practice, even more than usual, always choose the kind of contact that gives you the most relief.
Let's start. Place your palms on your cheeks. Don't press, just allow the contact. Take a natural breath and exhale slowly. One more time. The goal here is not to do a lot. It's to give the body a signal of safety. Now bring your fingers to the sides of the jaw in the masseter area. Find a slightly sensitive point and hold light pressure for about 10 to 15 seconds. Breathe calmly. Then switch to the other side and repeat. Even this small step can help a lot when stress builds up and the body stays tense. Now let's move to the collarbones. Place your fingertips above the collarbones or just below them in a soft area. Keep a steady but light contact for a few seconds, breathing slowly. If you want, you can do one side first and then the other. This area often helps lower the overall tone and calm that diffuse feeling of alertness. Now bring one hand or 2 fingers to the center of the chest on the sternum. Keep a soft contact for about 10 to 20 seconds. If you want, you can move slightly higher or lower and repeat. There's no need to press. We're calming the system, not forcing the skin, and not forcing the body. Now place one hand on the solar plexus or the upper belly. Keep the contact light and take a natural breath. Then a slightly slower exhale. One more time. If you feel tension in the stomach or upper belly, stay here for a few extra seconds. We do not need to change the breath. We simply accompany it. Now we'll work on the hands in a very helpful point for releasing nervous tension. Bring your fingers to the area between the thumb and index finger in the small, soft space of the hand. Work very gently here. If the area feels sensitive, even a light contact is enough. Hold for about 8 to 10 seconds, then switch to the other hand. You can repeat a second time, always with minimal pressure and a calm breath. To close, return palms on the cheeks or hands resting one over the other. Take 2 or 3 slow breaths, inhale naturally, and exhale gently. Notice the contact of your hands. Notice whether the body feels even a little less activated.
We're not looking for a perfect result. We're simply creating a moment of self-soothing and regulation. And very often that is exactly what helps the skin stop staying in constant alert. Perfect. This is a quick calming practice for skin and stress that you can use during moments of tension, agitation, or stress-related flare-ups, always avoiding irritated areas. Always remember, clear pressure, but manageable. Choose the contact that gives you the most relief and work gently. See you soon. Hi and welcome. In this video, we'll do a complete mini session that combines trigger point work and Psychopoints in a simple and practical way. The idea is very clear. First, we do a short mechanical release on an area of tension. Then we add a Psychopoint to help the system slow down and integrate the work. This sequence is very useful when you feel stress, overload, and stiffness in different parts of the body. Before we begin, one simple and important note. If you have sharp pain, a recent injury, strong inflammation, or significant neurological symptoms, stop and get professional evaluation. In this practice, we work only with non-urgent tension and overload as self-help. And remember, we do not work with direct pressure on the spine, throat, or joints. We stay on accessible muscle areas. The basic rule applies here too. Clear pressure, but manageable. With trigger points, we are not looking for pain. We're looking for a useful point that is noticeable, but tolerable. With Psychopoints, we slow down even more and use a more regulating kind of contact.
Let's begin with a moment of centering. Place one hand on your chest and one hand on your belly. Take a natural breath and exhale slowly. One more time. This mini session follows a simple logic: brief, release, contact, breath. Let's start with the neck and shoulders. Bring your fingers to the upper trapezius area where the neck meets the shoulder. Look for a point that feels a little tighter or more sensitive. When you find it, apply gentle or medium pressure, always manageable, and hold for about 10 to 15 seconds. Breathe slowly, then switch to the other side and do the same. This is the trigger point step: short, targeted, and without forcing. Now let's add the regulating Psychopoint. Place your fingertips at the side base of the neck or on the collarbone area, wherever the contact feels more calming. Here, the pressure is lighter. Keep the contact for a few seconds, breathing slowly, first on one side and then on the other. If you want, at the end, place your hands on your shoulders and take a slow exhale, letting some of the weight drop. Now let's move to the chest and breathing area. For the trigger point step, work on the upper outer chest near the shoulder in a soft area. Avoid the center of the sternum in this phase. Look for a sensitive but tolerable point and hold gentle pressure for about 10 to 15 seconds. Breathe calmly. Then switch to the other side and repeat. There's no need for intensity here. We're only looking for a short, useful release. Now bring the work to a central Psychopoint. Place one hand or two fingers in the center of the chest on the sternum with a light but steady contact. Stay here for about 10 to 20 seconds. Breathe naturally and let the exhale become a little slower. If you want, you can think of creating a little more space in the chest without forcing the breath. This step helps a lot with integrating the mechanical release into a sense of calm. Now, let's move down to the lower back and pelvis area. For the trigger point step, place your hands on the sides of the low back, above the pelvis and away from the spine. Look for a slightly tight point in the side lumbar area. When you find it, hold manageable pressure for about 10 to 20 seconds, then switch to the other side. Remember, do not press on the spine. We work on the sides calmly. Now, let's add the integrating Psychopoint. Place one palm on the sacrum in the low center of the back above the tailbone. Or place your fingers on the iliac crest at the side of the pelvis if that feels more comfortable. Here the contact is steady and reassuring, not strong. Stay for a few seconds, breathing slowly. Then place your hands on the hips and make a very small pelvic sway. Just a micro movement, only to help the area let go a little more. Pause and take a slow exhale. To close, place one hand on your chest and one hand on your belly, or one hand on the chest and one on the sacrum if that feels comfortable. Take 2 calm breaths. Inhale normally and exhale slowly. Take a moment to notice how the body feels now. We do not need a perfect release. We're simply looking for a little more space, a little less load, and a more stable feeling.
Perfect. This is a complete trigger point and Psychopoints mini session that you can use when you feel physical tension and emotional stress together. It's a simple practice, but very effective because it combines tissue release with nervous system regulation. Always remember, clear pressure, but manageable. First, we soften the tissue a little, then we help the body feel safer. See you soon. Hi and welcome. In this video, we'll do a complete daily Psychopoints routine, a simple 10-minute sequence you can use every day to release tension, regulate the nervous system, and reconnect with presence in the body. It's a practical guide designed to support you gradually from head to feet without forcing anything. Before we begin, one simple note. This is a self-help practice for tension relief and regulation. If a point feels too sensitive, lighten the pressure or skip it. The basic rule always applies here too. Clear pressure, but manageable.
Let's begin with centering. Place one hand on your chest and one hand on your belly. Don't press, just allow the contact. Take a natural breath and exhale slowly. One more time, and one more. There's no need to change the breath. We simply accompany it. Now let's move up to the head and face. Bring your fingers to the sides of the jaw, in the masseter area, and look for a point that feels a little more sensitive. Hold light pressure for about 10 to 15 seconds on one side, then switch to the other. Keep the mouth soft without clenching the teeth. Then bring 1 or 2 fingers to the center of the forehead and keep a steady but gentle contact for a few seconds. This step helps release mental and facial tension. Now let's move to the neck and collarbones. Place one hand on the side of the neck, not in the center of the throat, and look for a delicate but noticeable point. Hold very gentle pressure for about 10 to 15 seconds, then switch to the other side. After that, place your fingertips on the collarbones, above or just below, in a soft area. Breathe slowly. This step helps calm the high tone and soften accumulated tension. Now bring one hand or 2 fingers to the center of the chest on the sternum. Keep a light and steady contact for about 10 to 20 seconds. If you want, you can move slightly higher or lower and repeat. On the chest, we work gently. The contact should calm, not invade. Now, let's move down to the solar plexus and upper belly. Place one hand below the sternum in the solar plexus area and the other hand on the upper belly. Keep a soft contact for a few breaths. If you want, you can work one small psychopoint in the upper belly with very gentle pressure for about 10 seconds. Then return to the hand contact. Don't force the breath. Let it move however it can. Now place both hands on the belly, one over the other, around the navel or slightly below. Stay here for a few seconds with a steady but soft contact. Take a natural breath and exhale slowly. This step helps bring calm and presence into the abdominal area. Now let's move to the pelvis. Place your hands on the sides of the hips. Keep a steady and reassuring contact for a few seconds. If you want, make a very small and slow pelvic sway, then pause. This step supports grounding and stability. Now let's move down to the feet. If you are seated, you can place one hand gently around one ankle. Then apply gentle pressure to the center of the sole of the foot for about 10 to 15 seconds. Then switch to the other foot and do the same. If reaching your feet is not easy, it's absolutely fine to simply bring your attention to the support of your feet on the floor and feel the contact with the ground. To close, return with one hand on the chest and one on the belly, or leave your hands wherever you feel the most calm. Take 2 or 3 calm breaths. Inhale normally and exhale gently. Notice the body as a whole: face, neck, chest, belly, pelvis, feet. We do not need a perfect result. We're simply looking for a little more space, a little more presence, and a more regulated tone.
Perfect. This is your daily Psychopoints routine, a complete 10-minute sequence you can use as a daily guide. You can do it in the morning to center yourself, in the afternoon to release tension, or in the evening in an even slower version. Always remember, clear pressure, but manageable. Even a few minutes done consistently can help a lot. See you soon.